Okay, I'm Liz Randall and I'm the Healthier Communities Project Manager for Afan Valley Communities First. One of the projects that we've run this year is our Bumps and Babes project, but this year we work closely with Celtic Leisure and Flying Start and have worked up in Cymru Pool and provided mums, whether they're pregnant or new mums, the opportunity to get active in the water as well as meet midwives or health visitors. The Fit for Birth and Beyond project this year we worked with about 15 mums and about 85% of them made a positive healthy lifestyle change. To promote physical well-being, one of our projects is Foodwise for Life. Foodwise has been designed by dietitians in Wales as an 8-week healthy weight management programme. So this year we've run 3 programmes in the Afan Valley with about 35 residents. It's a really fun and informal programme, but it's really informative as well, and it gives people lots of information around the Eat Well plate, portion sizes, reading food labels, understanding the levels of salt, sugar and fat in their foods. And it's a great way to get people together to learn about nutrition, learn about healthy lifestyle, get them healthy, trying to eat more healthily, get a bit more physical activity. So this year, like I said, we worked with 35 people, 3 groups, and 70% have managed to reduce their BMI and become more physically active.
Okay, I'm Liz Randall and I'm the project manager for the Healthier Communities team with Afan Valley Communities First. We're here today at one of our Foodwise groups in Talbot. Foodwise is a Welsh Government scheme. It's been designed by NHS dietitians and it links with the Welsh Government's Change for Life scheme. It's a community weight management scheme and we cover a lot of topics in fun, interesting ways. So we discuss food labelling, the Eat Well plate and what constitutes a balanced diet. We talk about swaps and healthy swaps for food and drink as well. And we look at portion sizes, so looking at what constitutes a healthy portion size. It's an 8-week programme, like I said, it's been designed by dietitians, but we know that losing weight's not easy. So to support the residents, we extend the scheme up to about 16 weeks, so we're with them for about 4 months. And we do extra activities then around healthy cooking, so people get the chance to learn more about cooking for weight loss. They also do physical activities as well, so people have been encouraged to walk a little bit more. They've done gentle exercise classes, but we even tried Zumba as well. So, getting people more active, eating more healthy and cooking healthy as well.
I've learned about what to eat more of and what to eat less. I have done cut down on my sugars, cut down on my fat, cut down on plates, like put how much on plates and stuff.
My GP said it was advertised. They said for me to come along to see if I could find out different things about food, which I did. I didn't want to go to Weight Watchers and all that. I just needed to know about food and the portion control. And even though I'm a strict vegetarian, I was still eating things that weren't agreeing with my body. And I've sorted that out now.
As well as the Foodwise for Life programme, we also run our Get Moving, Keep Moving programme, which is getting people more active, out and about in the community, doing some more exercise. So this year we've worked with about 80 people throughout the valley, doing a whole range of physical activity. That could be something simple as our walking group, which has got about 50 members who are out and about walking in the Afan Valley. We also have done simple armchair exercises for those who may be a bit less mobile or a little bit older. We've done our Funky Fit classes, which is a new disco-style nightclub class with circuits and glow sticks and lights going all the time. We've also done a bit of Zumba, a bit of everything really, a bit of taste of people to get them a bit more physically active. And of the 80 people we've worked with this year, about 70% have become more physically active and have got a positive attitude to improving their physical well-being.
We just started one of our walks this morning, as we often do from Carmarthen Library. We are Carmarthen Come Walking Group. We started as the Walk Your Way to Health scheme. We have a lot of help from Communities First, from Talbot Communities First, and we walk, say once a month. We do a longish walk, and we like to introduce people who are not used to walking to the walks that are in their area, get them used to the paths, and let them know things that are on their doorstep which they perhaps don't know about. It's all to do with healthy lifestyle. We don't walk fast, we just go at a speed which will hopefully encourage everyone to come and walk with us.
To promote mental well-being, we've run a new project this year, which is our Men Only Mornings programme. We've worked closely with Neath Talbot Hearty Live scheme, and we've developed a programme specifically for men because we've noticed that all the health projects we were doing, it was predominantly women that were getting involved, and coming along to everything. So we thought, right, we need to start working with men, start thinking about their physical and mental well-being, and get them to come along, start talking about health as a topic. So the men-only mornings we've run throughout the year. We've had men from across the valley. We've had about 15 men come along. It's been a range of topics. We look at everything from smoking cessation, healthy eating, we've done healthy cooking with them, but we've also then looked at stress management, how to relax. So of the 15 men we worked with this year, about 80% feeling a bit more positive about both their mental and their physical well-being.
I'm Gain from Taste Buddies, and today we've got a project here of a men-only group. The focus of today is looking at healthy eating, encouraging the men here to cut down on their salt, their fat, increase their 5 a day. Most of the men here have very limited budgets and cooking skills, so that's something we will also address during the session.
Since I've been attending men-only mornings, I've been socialising and meeting new people. I've learned healthy eating and relaxation techniques.
Today we're making a nice healthy cottage pie, and we're also making a low-fat batter breath, which hopefully they will enjoy.
To promote healthy eating in the communities, we run our Food for Thought project. This is about giving people the practical skills to get healthy eating and healthy cooking in the kitchen. So over the year we've worked with about 50 residents to get them cooking a bit more healthier, and we've tailored the courses to meet the needs of the community. So we've done courses for men only, people who are living by themselves, so only cooking for one. We've done cooking for a family, and we've done cooking for mums, and we've even done cooking for those with special dietary requirements as well. So it's been getting people to back to basics, basically, get back to basics, learning how to cook from scratch, incorporating their fruit and veg. Right, so as a result of the Food for Thought project, the residents have been involved. About 90% of them now are trying to eat their fruit and veg daily, because some of the people we worked with weren't eating any fruit or veg before they started, and now because they've learned how to cook from scratch and a bit more confident, they're trying to incorporate their fruit and veg into their diet. To try and engage the general public involved with Communities First, get them involved in Communities First, we do a whole host of activities around our community involvement plan. So for this year, for example, we work closely with the 5x60 team, and have run activities during the holidays for school children to try and get them a bit more active, so doing games and sports during the holidays, but also getting the mums and parents and grandparents along too, giving them activities to do, to find out a bit more about healthy eating, maybe try a little taste of physical activity, try and get them over family things. We do our family activity days. We also have our annual healthy half-term event where we see hundreds of people coming along, dozens and dozens of partner organisations coming to meet with residents, give them advice and information, again give them taster sessions, give them something to do during the holidays, and try new activities really, find out more about mental health, physical health, healthy eating, healthy cooking. It's just really informal, a bit of fun, get people involved, find out more about Communities First as well, and see what they can get from it, what's out there for them to help them, whether it be learning, whether it be jobs, or whether it be health. There's something for everybody. As part of our community involvement plan, we're also working with the Council for Voluntary Service in Neath, Talbot, and the Welsh Government on the Add to Your Life scheme. Add to Your Life is an online health assessment, that's for those over 50. So we're working with CVS at the minute to arrange a whole host of activities for older residents to come along, find out a bit more about their health and the partner agencies available to support them, and try the online assessment and see what problems there are maybe in their health, and little hints and tips to make little changes. They'll have a big improvement on their health.